Do you remember the rules for delegation and assignment on the NCLEX? Well, in this item from one of NCLEX Bootcamp's brand new readiness self-assessments, we need to figure out which of these tasks is appropriate to delegate to an unlicensed assistive personnel. And remember, we cannot delegate anything that's part of the nursing process, that requires clinical judgment, and it needs to be a stable client and a routine task. So can we delegate placing a client on the bedpan 3 days after hip replacement? Well, this is going to require a little bit of special care, like we need to use a fracture pan, but at this point, this is 3 days post-op. This client has been on and off the bedpan several times, I'm sure, and they're probably even bearing weight on this extremity. So I would feel comfortable delegating this, but let's consider our other options as well. How about observing a client giving a self-injection of insulin? So no, this is evaluation, and evaluation is the final step in the nursing process and cannot be delegated, so this is not correct. Then performing intermittent catheterization. So although this is a routine task and dysuria is a stable condition, this is a sterile procedure. This requires specialized knowledge and skill related to sterile field, and so this is not appropriate for a UAP. Then adjusting an oxygen flow rate. So no, remember, oxygen is a drug, and drug administration is not within the scope of the UAP, so it's not this one either. So out of all of these, placing a client on the bedpan 3 days after hip replacement is routine for a stable client, and it is within their scope of practice. And we are correct. Great job.